Welcome to Village in Motion, this Wednesday, July the 18th. I'm Clint Lambert. I have the pleasure of being the host today for Village in Motion. And in the studio with me, I have Nelle Savino, who is a physical therapist over at Garden Ridge, and she's here to talk about falls and some of the things going on with Garden Ridge, transitioning over to Garden Ridge, and all the good things that physical therapy does. Welcome, Nelle.
Thank you, Mr. Lambert.
Glad to have you with us.
Thank
Very
you.
glad to have you with us. You are a physical therapist at Garden Ridge. How long have you been with us?
15 years.
Wow. Okay, very good. You must like it here.
Yes, I do.
I understand you do a very good job over there.
Thank you.
Residents greatly appreciate all that you do.
Thank you.
Speaking of that, people our age unfortunately have falls at times. Not because of being aged, but because of loss of balance, right?
Well, a lot of reasons, yes.
Okay.
One of the reasons is loss of balance, yes.
What are some of the other reasons?
Sometimes it's clutter in their apartment,
Okay.
or just accidents happen. A lot of times medication can cause the fall, or non-use of their assistive device properly. So there's a couple of reasons why.
With that, what can we do to decrease our potential for having falls?
So there's a lot of there's levels of care at Garden Ridge that we looked at, and we as therapists can screen patients on the potential of any incidents or helping them prevent falls. So at Garden Ridge, there's a long-term care setting, assisted living setting, and a memory care unit.
Right.
Falls, after a fall happens, unfortunately, if a fall happens, it can be triggered where the nurse can send us a referral on looking into all of the residents at Garden Ridge on all different levels, long-term care, assisted living, memory care, assess what have made them fall, and from there, see if we can be of benefit from them.
Okay.
Now, you asked me a question, how can we prevent falls?
Right.
One is through exercise.
Okay.
One is looking to their environment, how we can arrange their environment where there's less incidence or risk for falls.
Right.
Looking into their medication, which is a nursing issue, we can address that with nursing.
Okay.
Lighting, clothing, assessing their assistive device. Do they need a cane? Do they need a walker, a rollator? Things like that that would help them. Now, as you mentioned, as they are getting to that age where their balance is not as good,
Right.
maybe they need some kind of help to get them steadier with their walking and gait.
Okay. With what you do in looking at the environment in Garden Ridge, that's a pretty closed environment. But residents still have the independence within their room if they're in assisted living, right?
Right, right.
What kind of things should they not have in their room if they're going over to assisted living?
Unfortunately, a lot of the residents move from a big home to a one-bedroom apartment. So there's a lot of furniture in a small bedroom apartment, and really all they need is that space to move around and be able to access the bathroom, their bed, easily. So one of the things that is important is to free clutter, free the environment free of clutter. One of the things that they have to do.
When you say free of clutter, what is clutter to me may not be clutter to you, right?
Right, right.
So how do we determine what should be removed or?
Right. Not a lot of furniture.
Okay.
A place where, especially if they're using a walker, a place that you can turn around and move around with the walker.
Okay.
What else? Maybe I'm looking into maybe the things on the floor. If they have rugs that are not secured on the floor, those are things that really should not be there.
So we really shouldn't have those on the floor because
Right.
they slip or they get caught on our feet,
Right.
whatever.
Newspaper, sometimes they read and then they put it on the
Okay.
floor. Shoes that that are just laying around and not put aside. Clothing that they may have used and then put aside. Anything that would cause them to trip or fall.
Right.
Even in the bathroom area. Sometimes they put a lot of their stuff in the bathroom. They could not even access the bathroom. Those are the things that we looked at.
Okay. With that, if you determine there is something that needs to be removed, or that the individual has an increased potential for falling, what do you as a physical therapist do?
Well, we do a home assessment. We look at everything in their home and them themselves as well. So in the home, we can advise the family and the resident of what they can do to prevent falls,
Right.
which is rearranging their furniture or removing some of the furniture. Maybe adding some rails that will help them get in and out of bed. Maybe
Okay.
adding grab bars so that they can help. They can help pull up with a grab bar. Looking into where to put their assistive device, like a walker cane, so that it's accessible to them at all times.
Okay. One of the things that I see often throughout Greenspring are individuals who will have a rollator and they'll go to dinner and the rollator has been removed so it's not cluttering the dining room.
Right.
But they will decide to stand up and move around and they grab hold of chairs
furniture,
or
yeah.
furniture. Isn't that a severe potential of falls?
It is, and in that case, they really need to seek the help of the service people to help
Okay.
them bring the walker back to them.
Right.
It is a risk, first of all, not only for themselves but the other residents to rely on furniture that is not secure. So they have to have their own walker close by or be given to them after they have dinner.
Right. What about another resident helping a resident walk or to get around?
We don't advise that because that's something that, first of all, we don't know how strong or how much need the resident that needs help. And for them to just offer help may not be the best way. One is they need to seek help. Like the physical therapist can help out, assess. If you identify somebody who has difficulty or a high risk for falls
Right.
or balance issues, then we as a physical therapist can assess that and give them advice that would benefit them.
Okay.
Sometimes we see residents just purchase equipment that are not appropriate for them or may have purchased an equipment that is not fitted for them in terms of height, or the kind of assistive device that they purchased are not the one that's appropriate for them. Even power chairs, they just buy power chairs without really knowing the safety use of a power chair. So those are the things that we can take a look at in rehab.
All those assistive living devices you're talking about, ambulatory devices, do we need a physician's order to get any of those, or do we need to come see you before we purchase them?
It would be advisable to get a physical therapist to assess that, because if you just buy it and not know if it's really what you need, then
Right.
then that's a risk for you for
Okay.
falls. Yeah.
When you're assessing somebody for the type of device they might benefit most by, what kind of things are you looking for?
We look at the strength. We do functional testing. We test them on their balance scale, and there's a lot of balance testing that we can work on. We look at their endurance,
Okay.
their tolerance into standing and moving around, and all of this can are accounted. Their sensory, if they can feel the floor, and then we assess their walking pattern as well.
Okay. If someone just goes out and let's say buys a rollator, which people often refer to as just a walker, but they're actually a rollator as far as terminology. Many of the people do not have them the right height, as you mentioned. Okay, and I see that and think, ooh,
Right.
people are straining their back, they're bending over too much. What can they do if they already have that device? Can they come see you?
Yes, we can see them. We can adjust it for them. If we identify that there is a potential for need for physical therapy to help them out,
Right.
improve their walking, then we would recommend that to them, and they can seek a referral to their doctor that we can then see them for evaluation.
Okay.
We call a screen. We just screen them, but we cannot actually see them until a doctor signs off that yes, okay, have a physical
Okay.
therapy.
So for those of us that live in independent living, we would go through outpatient physical
Outpatient rehab, yeah.
And for those that are at Garden Ridge, they would just ask to see one of the physical therapists?
Right. We usually, in inpatient, we usually see the people that just came off of the hospital, the acute care patients that have been discharged and now transitioning to rehab.
Okay. You mentioned transitioning to rehab. we have to transition to Garden Ridge before we transition to rehab, right?
Not necessarily, not
Okay.
necessarily. You can go straight to outpatient. You don't have to be an inpatient to be seen by a physical therapist. That's
Okay.
why we have all the two division of inpatient and outpatient. For independent living residents, they can go straight to outpatient.
Okay.
Now, assisted living is considered outpatient. So when we get a referral through assisted living, that's considered outpatient. Then outpatient rehab will see them.
Oh, okay. And how often are you seen by is a person seen by rehab?
If you are in Garden Ridge, we evaluate you and then we set up a program to see what would benefit you. It can be every day, Monday, 5 times a week to 6 times a week.
Oh.
If you are an outpatient, you typically are seen maybe 2 to 3 times a week in outpatient.
Okay.
Or again, as the need is required.
Okay. Do you do balance classes?
Yes.
Do you offer balance classes?
Classes, no, we are individualized. We do one-on-one patient care.
Okay. Because I know that Fitness Center offers balance classes.
Right.
As such.
We're more specialized in terms that we specifically looked at a particular problem and then deal with that patient one-on-one. When you are at a higher level where you don't need a big group, a one-on-one,
Right.
then you can join a group, and that's mostly maintenance therapy,
Okay. Very good.
which is very important
Yes,
too.
yes.
Yeah.
Because even though we may be having good balance today, we may not tomorrow.
Right.
Okay. We're about to run out of time here. Any other last minute comments?
Well, if you need our help, we're always in inpatient rehab. All you have to do is come visit us, say hi to us, and if we can be of help, we'll be happy to help you.
Great. Nelle, thank you so very, very much
Thank
for
you. My
being
pleasure.
here. And wonderful information. I hope everybody takes advantage of our outpatient services and all the physical therapists that we have here.
Thank you.
Thanks again.